Dr. K. Saiprasana, MBBS, DMC, eldest granddaughter of Pandurangam, a great Naurapath. Her maternal grandfather was Siddha medicine practitioner. So being allopath, she follows an integrated approach of allopathy, naturopathy and Siddha has adopted in her practices. She deems it a pride to have conducted more than 25,000 deliveries in Thiruvannamalai district. She is a lifetime member of Indian Medical Association and served as Joint Secretary for a couple of years. Please welcome Madam.
Of you here, a wonderful 75th Independence Day, Azadi Ka Amrit Mahotsav. Today morning I hoisted flag in my hospitals and took photographs with my patients, everything. Started celebrating Mahotsav as Modi ji told from this today morning itself. Because I know the value of what freedom is, because I've heard stories from my grandparents right from my day of birth, I should say. And I was always told about inspiring stories about Chhatrapati Shivaji and other people. And one more greatest advantage of me is to be with my grandfather, Panduranganar, who is a Nada naturopath. He was on fruits and raw eating pattern from the age of almost 28 till he died at the age of 85. And so I used to be with him all the time because I'm the eldest granddaughter and used to observe him day in and day out, how he treated his patients through naturopathy, through yogasanas, through pranayama, through sun bath, mud bath, whatnot. But all these treatments will extend for days for you to benefit from these treatments. But I've observed that not one single disease just stayed in the body. Even cancer, like pulmonary cancers, vanished off with this kind of treatment. It was actually relating to your roots, staying with your roots, returning back to your paramparya knowledge. That's what I should say. And when I became a graduate from Stanley Medical College, fortunately, my maternal grandpa was from Siddha. And there at Kadalur, his hospital's name is Agastya Aushadalaya. And so he used to treat patients with Siddha practices. There will be all the time 3 to 5 people, drug making people, or we make legumes, home water, soam water, paspam, everything in the backyard. I used to run here and there. And there also I was an observer. So I was brewed in a pot of both traditional medicine and I graduated in allopathy medicine. So now at present, I just use my allopathy knowledge to diagnose and to select people. This kind of body will respond to naturopathy. This will respond to Siddha and some will respond only to allopathy because the damage done to them is so much, to their body is so much. So with my knowledge of allopathy, see, I will not blame allopathy. It's a wonderful system where you can diagnose, you can see through, and you can actually plan what you have to do. But with that knowledge, you have to decide for the patient. It is a tailor-made treatment. Today, my sister Jayanti, I should thank her, and Professor Nadarajan, and son of the soil, Dr. C.K. Ashok Kumar, all of them for inviting me here to deliver my own excerpts from my clinical practices about infertility. I went to Thiruvannamalai in 1986. At that time, I can divide till now into 15 years of practice, maybe 10 years. A decade we can divide. The first decade from 1986. If I take that, when patients came to me with history of not having a baby, it was very easy for me. Just to tell them some diet, give medications for both the partners. My practice is to evaluate both the partners before we treat for infertility. So when we evaluate both the partners, either one or both may be responsible. So that first decade from 86 was pretty easy. That was a year where there was not much of westernization in Thiruvannamalai, I could say. So it was only a matter of certain little medicines, more of lifestyle modification. And this place, this district is the downtrodden district of Tamil Nadu. Most of them were farmers. My first advice for the farmers would be refrain from the fields, refrain from pesticide usage, stay together in your house and eat, do some raw eating at least 50%. With that, they were able to produce babies. Then after in 2000, then came a period where scan came and other investigations, big investigations came. Even when we give so much of medication, even when we treat with lot of, lifestyle modification, inputs and other things, they were not conceiving easily because the human body is transforming into something else. Even if you touch a body, by the skin you can say it was not at all flexible. The skin of the woman was not flexible. You call it as a state of acanthosis nigricans, the precursor for diabetes mellitus. All those who came to me with a history of infertility, they were all completely damaged. That's what I could say. Just because we easily talk, it's only because of lifestyle modification, things are happening. But no doctors sit with their patient, ask them what is their complete history, and guide them what they have to eat in the morning, in the lunchtime, and at the night time. Usually, I would like to tell our practices here because that will give a lot of insight. Rather than discussing about what are the causes, what are the treatments available for infertility, let me talk the common things here. The infertility in women, see, when women want to conceive, there are three things that should happen. First one is she must ovulate. She must produce good eggs. Second thing is there should be enough fertilization. The egg should get fertilized at a proper time, proper mode. The third is implantation. The fertilized egg, the small baby, it should stay in the uterus. It should stick and then grow. These are the three phases for a woman to become pregnant. We'll go one by one. For ovulation, the woman is the only thing responsible. For her to produce proper eggs, she must be like a goddess. I always say Garbhatavam in Tamil. A woman should make a penance, not for becoming pregnant. Even before becoming pregnant, she must be very pious, spiritually, bodily, eating habits. That's why our ancestors taught us so many vradams. Monday one vradam, Tuesday one vradam, just to cleanse our body, just to send all our bad things out of the body. So for ovulation, the body should be very, very adaptive. It has got to have certain conditions. The woman should be thin. Thin in the sense, healthily thin, not very thin. She should never be obese. She should never have a tummy. I like one Siddhar, Thirumular Padal. Even today I recited to two of my patients. Andam Surungil, Adarkor Azhivillai. Pindam Surungil, Prana Nilai Perum. Undi Surungil, Ubayam Palavula. Kandam Karutha, Kapali Umami. Andam Surungil means if the universe should be shrunken, even the sun, when it enlarges, it becomes red giant. One day, even the sun will burst. So the stars should be shrunken. Pindam Surungil, Ubayam Palavula. That means the body should be in a shrunken state. How it should be like that? It should not swell. There should not be intracellular inflammation in the body. Undi Surungil Ubaya Palavala. For that, one means is control your diet. Every woman and man should follow this if they want to become pregnant. For ovulation, the woman should be healthy enough to produce good eggs. How will the good eggs come? Only if you have good habits, only if you breathe properly, only when you live in proper conditions, only when you live stress-free, only when you're happy, and only when you have the sexual drive in you, and only when you have the desire to conceive, you will ovulate. If not, you will not ovulate. It is not only medicine that is going to help a woman to conceive. It is a balance between mind, body, and soul. As my previous speaker told all of you, your body should be like a temple. It should have healthy things happening inside your body. The hormones should be working properly, especially thyroid. Thyroid is a mother hormone. The first symptom of your erratic lifestyle disorder is change in your thyroid hormone. When the thyroid hormone changes, it triggers every other hormone to go haphazard. All the hormones become haphazard and nothing will work properly. For ovulation, I will explain you simply in 3 steps. You simply think a mother and father. A mother is a homemaker. A father goes out to get, I want some water. If a father gets some salary and gives to mother, mother will cook and give to the children. I'm explaining the hormones in a very simple example. Father is the hypothalamus, pituitary hypothalamus axis I'm talking about. If doctors are here, they will understand what I'm talking about. If the first place works properly, it sends a trigger to the next place. And from the head only, all the hormones pass through the bloodstream, goes to the ovaries, goes to the uterus, and ovulation occurs in your ovary. So, where the actual process starts? Process starts here. Excuse me. When your mind is not at constant symphony with your body, ovulation will not occur. Many of the English doctors like us, they miss this. They keep on investigating. They keep on giving medication. Then the treatment goes on and on. Actually, when a woman comes to you, you have to sit and talk to her. That 90% of the women and men will conceive automatically if there is mind, body, and soul symphony. It is like a musical pattern. It should flow with the universe. You should be connected with the universe. You should be connected with your husband. You should be connected with your family. You should have the desire to conceive, listen, and you should have the desire to control your food. Many women don't control their tongue. That's why ovulation never occurs. So when the woman produces egg, there is 50% chance to conceive. Next, where it comes, fertilization. For the fertilization, you need your husband or your partner because fertilization is 50-50. If there is a good egg, then the sperm should get in and it should fertilize, break the shell of the egg, and then the sperm should enter, and then she must become a fertile egg, he or she. For that, the man should produce proper sperm, right? The proper sperm, what I mean is, it should have a head, it should have a tail, it should have an acrosome, everything. The morphology of the sperm of a man is very, very important. Next comes the motility. If the motility and morphology of a man is impaired, even if the egg is coming for the woman, the man cannot make the wife pregnant. And for this step of fertilization, you must have both the partners in harmony. Both of them should have their body, mind, and soul work together. They should have a better and best lifestyle, living style, better way of eating, better way of sleeping, better way of breathing, and most importantly, better way of loving each other and believing in each other. So, for a man to produce sperm properly, he should also not be obese. He should also not be stressed. If his lifestyle warrants a retirement from his work for 3 months, I also advise, please stay at home, go for a retreat, go for a tour, follow all these things, you'll become pregnant. It is not easy. All the time, our people are stressed. All the time we work. And one important thing, what I observe is late eating hours, late screen time, going to bed by 10 o'clock, chatting till 12 o'clock, you have your screen time, and your melatonin never comes in. And what happens when you want to have sex? Nothing works. It is a failure in sex. If you want to have beautiful sex, eat food before 7 o'clock. Switch off everything. When we were growing in our, we had an ashram actually, where many people were living together. I was there where I was born and I was growing up. And so by 6 o'clock, lights off, no lights. We needn't do homework. We needn't do anything. Simply chatting, singing, dancing, being, and giving the time for ourselves. And so after the sun sets, my tata used to tell, shut off, shut down, be happy. By 8 o'clock, when you don't put electrical bulbs in your dwelling unit, automatically sleep sets in. When the couple goes to bed by 8 o'clock, you wake up by 10 o'clock, hold your hand, chat nice loving words, then indulge in sex. Then fertilization happens. You give medication, you calculate your days. We also give days, of course. We calculate ovulation. But all these things should be a precursor before a sex happens. Many of us miss, many doctors miss, all the couples miss, and they end up in infertility. Right? So for fertilization, once again, it is a body, mind, and soul playing harmoniously like music. Here, the part of the man comes to an end. If he is producing proper sperm, there ends his work. That's all. He just gives a drop for the woman. Rest, once again, the woman's problem. Then fertilization occurs. After fertilization, implantation. What is implantation? The fertilized egg goes and sticks on to the uterus for the first 3 months. The environment of the uterus should be very adaptive to the fertilized new baby to be there. If there is improper hormonal adaptiveness, or if the uterus has got certain problem, certain disease, even if the baby is formed, it passes through in the periods. Or even though the baby survives, by 12th week, it gets aborted. And here I've observed, nature has got a beautiful law, nature of selection. If your fertilized egg is not good enough, if it has got malformations, your egg or sperm is defective, then abortion occurs. Most of the abortions are due to natural selection. Only 5% is because of the defective uterus. And so, if you don't conceive, you take steps for ovulation, the man should produce sperm. He should be good in his part. Then the fertilization. Once again, body, mind, and soul. And next comes implantation. For implantation also, the woman should have adaptive environment, and then she should not have any hormonal imbalance. She should not be obese. She should be stress-free, and she should always be in a good mental status. Everything goes fine. Infertility now is actually 50% prevalent globally. In India, every 10 women getting married, 5 of them conceive naturally. Rest 5 need assistance, and out of 10, 1 never conceive at all. For every patient coming to us, they will be having notes regarding IUI treatment and infertility, culminating in assisted reproductive techniques. When they come to our hospital, we evaluate both husband and wife, and we put them on 6 months lifestyle modification. We teach them breathing exercise. We teach them lifestyle modification. And Jayanti would have observed, I always put them on 1 coconut per day. Husband should eat, wife should eat. I don't know, the modern medicine and rest of the world, All of them are afraid of this raw coconut eating. I'm not talking about cooked coconut. I'm talking about raw coconut eating. If you eat one coconut per day, automatically you become pregnant. You do exercise, raw coconut eating in the morning, raw fruit eating, raw sprout eating, all these things till 11 o'clock in the morning, we advise as the basic lifestyle modification in our hospital. Because from morning 5 o'clock till 11 o'clock, all the hormones keep producing. Only the hormones related to your digestive tract are produced 3 times a day. Rest of them, they all finish by 11 o'clock. That's why Brahmins eat by 11. When you eat early in the morning, all the hormones, everything gets stopped because the blood circulation is diverted to your stomach. Where will the blood go to the other organs? The hormonal producing system. And so morning, we ask them to eat half the tummy. Raw eating is a must in our hospital. In the afternoon, half food. By 6:30, the couple should finish their food. By 7, no screen time. By 8, getting locked up in a dark room, sitting, chatting. And then you go for any other sexual habits. And I swear you, we have given more number of natural births, natural conceptions, and very few go for IUI, ART techniques in our hospital. I am treating infertile patients from 1986. I've got books and books, recorded books. I do not have times to put them in a column and publish them. I am really feeling bad because there's no time. But Jayanti has seen what I am doing. The follicle which is developing in one cycle by raw eating and coconut eating, the follicular circulation I've seen improving because I do the scan. We do the scan ourselves. And so when the couple are interested in naturopath eating, yogic practices, we actually see with our eyes how the follicle are changing, how teratozoospermia turns into normozoospermia. I've got evidence. I don't have time, my dear viewers, to go and talk about this to the entire world. But in my Tiruvannamalai, whom all are coming to me, I'm happy. I'm proud to say, little bit change I'm doing to the infertile couple in the practices I learned from both my grandpas, Panduranganar and Dr. Ramapurthy, a Siddha practitioner. Many people don't get because allopath always talk ill about alternate medicine. But I am brewed in alternate medicine. I am brewed in allopathy. And in our hospital, we train doctors to use both. Both. Everybody needs everything. You do it. Your treatment should be tailor-made, not a fixed. Everybody is unique. Every couple is unique. So every patient will have a treatment schedule, a lifestyle modification schedule. And also, every patient will have a chart to follow. So many things we do. And this time given by your Manushi Institute of Yoga is very little for me to explain. But I tell you, in the morning, raw eating, good breathing exercise, and always advise 5 kilometers walk. Both couple, I usually say, Kadalodu, Kaikorthu, Kalayil Nadandal, you will get a baby. What does Kundi Devi's Purana says, what Mahabharata says? Kundi have given birth to sun god. Panchabuddhas, it is talking about Panchabuddhas. A woman should have sun, breeze, good water. That is about Bhima's birth, Karna's birth. But we are putting it into Puranas. A woman should have good sunlight, good breathing, good sural, everything, environment. Then only she produces egg. Woman is the foremost thing for producing a good baby. And then comes the man's part. And this is what I've observed. And I would like to have a 5-minute questionnaire for all of you to question me regarding this. And I think I'm going out of my time. And I'm happy when you combine all these practices.
We are very happy, Ka.
Yeah.
This is 75th year. So please say about your grandpa and grandma, Ka. We will be happy, Ka. We are not running out of time. Please. we would like to hear
Thank
from
you for the time given. My grandfather's name is Tyagi Panduranganar and my grandmother's name is Saraswati Pandurangam. She was the woman who worked for freedom and post-freedom struggle also. She was in Kamarajar government. She was 3 times MLC, a councillor, deputy mayor of Chennai. And from Tamil Nadu, few freedom struggling women served before independence and after independence. She lost her first child in Kannanur jail. The child was 3.5 years old. My aunt's name is Vijayalakshmi. She went with the child to the jail under the British and she was incarcerated. She lost her child. My aunt's body is in Kannanur jail. And my daddy was delivered inside the jail. And so he was called as Kannabiran. He is also a doctor and he's an allopathy doctor, right? And the third child became deaf and dumb because she donated the child and went to prison. A relative was bringing up the child, and at the age of 4, the child got into brain fever and lost his speech. This child, my Chittappa, is a living example how our ancestors fought for this freedom. And this much suffering had happened in our family. And every time, see this, it is a separate genre I should talk about. And every time how they got beatings from Britishers, how if the jails are full, women were left in Pudal jail in Chennai, Pudal forest, Red Hills forest. And my party and other women freedom fighters, they were indulged in giving food to the struggling freedom fighter men folk. And they have traveled at night, cooked in the forest, distributed pamphlets where the next meeting is occurring, all that. And these Britishers had a very beautiful technique. If the women are helped, they used to burn the families of freedom fighters. And so my grandpa and grandma were literally thrown on street. Their house was burnt and none of the relatives were helping them. So they were on the streets. They just used to go by trespass. Street passerby, and they used to give food and go. So no helping hand. If you want to fight for freedom, you ought to be on the roads. You ought to go to jail. My tata lost all his teeth because he was lathi charged. By the age of 40, there was no teeth. He was not able to eat. And because he was a fruitarian, nothing mattered. He lived long up to 85, 80, beyond that. But imagine without a family on the streets, every time going to jail and fighting, and so much of struggle they had. And women were also got lathi charge during that time. Because Mahatma told, get the lathi charge. It is not like simple beating. One lathi charge, they have to fall on the road. Once my tata became unconscious and he was declared dead. But because my tata knew pranayamam, he went into an yogic state. So he was thrown and the police went away. And after 1 hour, he gained conscious slowly. And then 1 month he was bedridden. Then once again he went for freedom struggle. He was having a beautiful job in a printer's thing near Kuralagam. He was earning 15 rupees in 1920s, imagine. He quit his job. He came state first in shorthand examination. That's why the Britishers gave him that job. But he went behind Mahatma Gandhi through all his things. My party was a rich lady. She came from Burma to a rich father, from a rich father. She gave all her jewels. She gave all her earnings, went behind my tata. Until the end, she was a porali. Because when Kamarajar lost his government, the school, everything, we were running. I don't want to go much into politics. Kamarajar அழிக்கணும், Kamarajar left hand, right hand எல்லாரையும் அழிக்கணும். அப்பதான் politics நல்லா இருக்கும். That time also she was fighting for a school, for her ashram, everything. I saw my granny as a fighter woman till the end. And that is the inspiration. Till now, என்னுடைய நாக்குல நல்ல வாக்கு, என்னுடைய மனசுல நேர்மை, என்னுடைய செயல்ல சத்தியம், என்னுடைய நெஞ்சில எப்பயுமே சுதந்திரத்தோட அதனோட அட்டாச்மெண்ட், தாய்மண்ணின் பாஸ் எல்லாமே இருக்குன்னா என்னோட தாத்தா பாட்டிய பார்த்து கேட்டு நான் வளர்ந்ததுனாலதான். நம்மளுடைய மண்ணை நம்ம நேசிக்கணும் அப்படின்னா எதுவுமே பண்ண வேண்டாம். நம்ம தொழில் தர்மத்தோட இருக்கணும். நம்ம சுத்தி இருக்கிற மக்களுக்கு, நம்மளுடைய சமுதாயத்துக்கு நம்ம ஏர்ன் பண்ற ஒரு பங்கை கொடுக்கணும், மக்களுக்கு கொடுக்கணும். அடுத்து மண்ணை நேசிக்கிறோம்னா என்வாயன்மெண்ட்டையும் நேசிக்கணும். நான் 1986 திருவண்ணாமலைக்கு வந்ததே என்னோட பாட்டி வில்லேஜ் சொன்னதுனாலதான். நான் ஃபுல்லா சென்னையில தான் இருந்தேன். 1986 இங்க வந்து நிறைய அபார்ஷன்ஸ் கேசஸ் ஹேண்டில் பண்ணிருக்கேன். இது வரைக்கும் 30,000 டெலிவரிஸ் பண்ணிருக்கேன். வரவங்களுக்கு காசு முதல்ல நான் கேட்டதில்லை. இது அத்தனையும் என் பாட்டியை நான் லவ் பண்றதுனால, அவங்க பிரின்சிபல்ஸோட நான் வாழ்றதுனால எனக்கு இது சாத்தியமா இருக்கு. என்னால அரசியல் போக முடியல. பட் as a Rotarian with my husband, I've traveled across globe. நான் அரசியல்வாதியா இருந்தா தமிழ்நாட்டுல இருந்திருப்பேன். ரொட்டேரியன் இருக்கிறதுனால ஸ்ரீலங்கா, ஜப்பான் எங்கெல்லாம் போனோமோ, ஆப்பிரிக்கா எல்லா இடத்துக்கும் போயிருக்கேன், ப்ராஜெக்ட்ஸ் பண்ணியிருக்கேன். அதனோட சீட் எங்க இருந்து வந்ததுன்னா ஃப்ரீடம் ஃபைட்டர்ஸா இருக்கக்கூடிய என்னோட தாத்தா